Hi, welcome back to my fourth video of my prone positioning and ARDS video presentation. This is video 4, ARDS Net Protocol, Part A. So we will be talking about the inclusion criteria of the acute onset of any of the following here. So if your PaO2 over your FiO2 is less than or equal to 300, it is, which has also been corrected for adults, it is also an inclusion criteria. Second, if there's any bilateral infiltrates consistent with pulmonary edema, if that shows up on any of the chest x-rays or any CT scans that you conduct, that's also a criteria. And lastly, no clinical evidence of left atrial hypertension. So if there's any hypertension showing up through either that CT scan or through a different form of testing, you're also in clinical. That's also a criteria as well. So part 1, ventilator setup, ventilator setup and adjustment. First you'd want to calculate the predicted body weight, and to do so there's two ways. There's males and females. With male, it's going to be 50 plus 2.3 times your height in inches minus 60, which is shown down here. Second, you want to select any ventilator mode. Usually the doctor will either let you know what they would like to start out on, but most of the time it's just going to be a volume control or a pressure control. Though I noticed that most pressure control ventilator modes are not initiated firstly until it's a little bit underway, or if the patient is requiring that adjustment in PEEP. Set ventilator settings to achieve initial tidal volume, which is equal to 8 milliliters per kilograms of predicted body weight. You'd want it to reduce the tidal volume by 1 milliliter per kilograms at intervals of less than or equal to 2 hours until tidal volume equals 6 milliliters per kilogram per the predicted body weight, and set the initial rate to approximately baseline minute ventilation, which is not greater than 35 beats per minute. Adjust the tidal volume and respiratory rate to achieve your desired pH and plateau pressures with the goals below. So we'd want an oxygenation goal of a PaO2 of 55 to 80 and an SpO2 of 88 to 95%, which is like your baseline. You just want to keep them saturated. So use a minimum PEEP of 5, because anything greater than that, you run the risk of developing a pneumo, because these patients have really frail lungs or the chronic lung diseases, and always want to keep in mind the protective lung protocols. So with lower PEEP and higher FiO2, you have this chart here. So let's say for chance you want to start off with PEEP of 5. Normally you'd want to start with FiO of 30, and that's where you want to get to. But if things get worse throughout the ventilation of the patient, and you see here the guidelines for that. Same thing here. If you're starting with some really high PEEP therapy, then you'll see these right here. But higher the PEEP, lower the FiO2. So if you're starting off pretty high, you'd want to start with lower FiO2 and then build up with the pressure there. So plateau pressure goals, you'd want to be less than 30 centimeters per water pressure. You also want a plateau if your plateau is greater than 30 centimeters per water pressure, then you want to decrease your tidal volume by 1. And if your plateau pressure is less than 25 centimeters of water pressure and your tidal volume, you'd want to try to regulate that together as well. So the second part of your ARDS net protocols is that you want to keep a pH goal in mind. So really, since this is a chronic lung disease, or that it can happen acutely, you'd want to try to keep your pH between a 730 to 7.45. These are very minimal baselines. The reason is that the lower in pH you go, the more acidic your blood's going to get, and that middle way is a good starting point to try to get your bases around. So if it's an acidosis management, you'd want a pH less than 730, or if the acidosis management, you could have a pH of 730, then you'd want to go ahead and increase your respiratory rate until your pH is at the minimal levels that you want, so anything greater than 730, or a PaCO2 of less than 25, then your max in respiratory rate is going to be up to 35. Anything more than that, you're adding more pressure to the lungs, which can result in injury. If the pH is less than 7.5, 7.15, increase respiratory rate to 35. If the pH remains less than 7.15, tidal volume may be increased in 1 milliliter per kilogram increments until your pH of greater than 7.15 is achieved. Plateau's target of 30 may be exceeded, so your compliance in your lungs can be elevated, which is fine to do so in that management since you have such an acidic pH level. Then that's something that you can discuss with your provider, and if they give you that leeway, just to make sure you're constantly with your patient, checking on them, getting your ABG routines, just to make sure you're hitting that goal. Your alkalosis management, if you have a pH of greater than 7.145, then all you would need to do is either decrease your event rate if possible, or try to manage that eye time as well. Thank you.